Hello, everyone, and welcome to the Baby's First Test webinar. This is Natasha Bonhomme. I'm the project director for Baby's First Test, and am very happy to have you all on the line. We are really excited to be able to share with you kind of the next iteration of Baby's First Test, where we've been, some of the history, and some of the activities that we're working on. Just to get these pieces out of the way in terms of the logistics, the webinar will be recorded and there will be a link available online on the Baby's First Test YouTube channel within 48 hours. If you have a question, please submit it through the chat box that is in your GoToWebinar control panel. We will be addressing questions at the end of the webinar, so definitely keep track of them since we'll be covering a range of different topics. And also, if you have any other IT or technical assistant needs, feel free to use the chat box to communicate with us, and we will work with you to get everything all squared away. So with that, this is just a quick overview of the different items that we will be going over. A little bit of history, but we'll definitely be focusing on the work that we have been doing more recently and some of the future initiatives that we have. And we're hoping to be able to do that within about 40-45 minutes so that we can leave 15 minutes for more time for questions and discussion through the chat. So who are we? And we are the Newborn Screening Clearinghouse. We really are set to increase newborn screening awareness and education through engagement. Now, this program came out of the Newborn Screening Saves Lives Act of 2008, as well as the reauthorization in 2014. And there's a specific line in there that discusses the need to create and maintain a clearinghouse of newborn screening information. And it's meant to connect a range of different stakeholders, including new parents, expecting parents, healthcare providers, policymakers, state programs, and any other stakeholders that are part of the newborn screening landscape. So really quite a large breadth of people, but with the focus really being on providing information and education and connecting people with the information that they're looking for. The build out of the clearinghouse and Baby's First Test is based on a range of programs that were done in the mid-2000s that were called the Consumer Focused Newborn Screening Project. Those are programs that Genetic Alliance had that were also HRSA funded that really focused in on the consumer and family experience of newborn screening and what would help families navigate that process. And those families were not just those who had a diagnosis at the end of newborn screening, but also those who had to deal with a false positive or carrier identification or some of the different issues that come up through screening. So that really fed in nicely with the idea of creating this clearinghouse and to be able to create a one-stop shop for newborn screening information and education. So what we do, our mission statement, if you will, is listed here in terms of the fact that Baby's First Test houses the nation's newborn screening clearinghouse. And as the clearinghouse, we connect parents and health providers with extensive information and resources at the local, state, and national level. And while this time on this webinar, we will be focused on what we've done through babiesfirsttest.org, it's really important to note that this program is more than just a website. We do work with trainings with families. We do almost kind of consulting or helping people who are creating newborn screening specific education materials, giving them advice on how to do that, how to pull that together, really kind of keeping track of trends in education and awareness building around public health programs, particularly newborn screening, but also trying to see if there are lessons learned to be found in other areas. So again, we're more than just that website. And here listed, you can see all the different ways that we look to connect people with the information that they're seeking. I'm not going to go through all of these, but there'll be some of these pieces that we'll highlight today throughout the webinar. So this is kind of a very condensed version of the history of the program. I won't go through all of these pieces, but it just notes kind of where we are in relation to some of the other events that have happened, such as in 2008 when the Newborn Screening Saves Lives Act was enacted. In 2011 is when we launched babiesfirsttest.org. We spent 2 years working with stakeholders, getting feedback from state programs, from families, from advocacy organizations, really understanding what people wanted to see and what they thought was needed in a clearinghouse to get to the point of launching babiesfirsttest.org. We relaunched our consumer task force in 2012, which I'll talk a little bit more about that, but really being able to go out and find people who are passionate and motivated about newborn screening and giving them more of an in-depth training of what that is. Then it was all of a sudden time for the reauthorization again, which did include a highlight of the clearinghouse. Last year, we relaunched our site. It's amazing what we learned in terms of how people actually use the site, what they were drawn to, and how we really needed to update our website so that it actually functioned best for the end user and not just for the content that was on there. But we also launched our Spanish language site and created our first mobile app. And this year, we've had a number of other tools and modules that we've launched, again, with this idea of connecting people to the information that's out there but can be sometimes hidden when it comes to newborn screening. And so this is just a screenshot of the newest release of the site. You see now it really highlights what your states offer and find a condition. The reason why those are highlighted so prominently is the fact that we found that 80% of the traffic that comes to the site is really looking for these two pieces of information. Again, we were able to learn from when we first launched the site to be able to take that learning and the data from that and reorganize the site in a way that actually matched the behavior of our users. So here are some numbers. Since 2012, we have trained 37 consumer task force members across 18 states. We really are excited that we've been able to do this. This is typically about a 9-month to 12-month program where it's a competitive process that people have to submit an application to, and then we work with them to give them deeper training in terms of what does newborn screening look like at the state level, what does it look like at the national level. We've always been really lucky to have someone from the Secretary's Advisory Committee on Heritable Disorders in Newborns and Children present to our consumer task force directly about that. We work with them on project management, and then they go and they implement a program in their location. We've had everything from one woman visited all the OBGYN offices in Houston and sharing information about newborn screening and working with those healthcare providers to talk about newborn screening before the baby gets here. We've had someone who's created really great graphics to show how newborn screening fits into all the different other types of screenings that happen both during the prenatal period and then also after the baby gets here. We've had people work with their school boards, and that person was a school nurse. So really a range of different programs. And what we really think about this program is that it really gives those families and those parents who are on the task force confidence to go out and do other great things in newborn screening. Many of them, after being part of this program, have gone off to work with their newborn screening state advisory groups, which we think is a really great connection. I'll go through the rest of this relatively quickly, but we have over 1,000 pages of content that includes information on 77 newborn screening conditions, and we're actually adding to that list. We've had over 1.6 million visitors to the site, so that's 1.6 million unique visitors, and they have produced over 2 million sessions. And so we're excited about that. We're hoping that reach continues to grow because we know that every day people are having babies and have questions, and so really trying to increase our reach. Since 2014, we had a 100% increase in the visits to the site. And what that really showed is that we were really starting to get to a bit more of a tipping point. And that really has to do with the fact that not just are people finding babies' first tests through our efforts in search engine optimization, but also they're finding our content on other trusted sources, such as whattoexpect.com and CDC and a couple of other places. This is our traffic breakdown, again, just to see where things are. We've increased the number of organic searches, and so that means someone just typing in newborn screening or something along those lines and finding us, and so that's great. And you see our top referrers are at the bottom there. These are the most popular, our most popular content. And number 5, where it says just other condition pages, that's always kind of changing. You see the states that we get the most traffic from are the states with the biggest population, so that makes sense. And while 70% of our traffic does come from the United States, I think it's really interesting that 30% comes from outside, and we, of course, don't do any type of targeted advertising or appeal or reach there. I think it really just shows, like for many things, but particularly newborn screening, the United States is such a standard bearer, and people are looking to us in terms of what to do and what information we have. And the last piece before I hand it over to my colleague is that we have gone mobile. In 2015, we launched the iOS version of the Baby's First Test mobile app, so that's for iPhone and Apple products. We created the app because we saw that because people were really going to the site for 2 main pieces of information, what their state screens for and condition information, we realized that there was such a need for that it would be great to have a way to have people just be able to go directly to that. We had actually heard back from a number of nurses and other health professionals that we would meet at conferences who said they loved going to that because, their facility was on the border and, some of their babies were born in one state but were receiving services in another state. And so we really went to be able to have that information. And so we are excited to be able to follow that and see what does it mean to have, now Baby's First Test and newborn screening information, not just available via the internet, but also, through an app, and what are the lessons learned in that form of education and outreach.
Great. Thank you, Natasha. As Natasha mentioned, my name is Jackie Seisman, and I'm the Assistant Director of Baby's First Test. So, kind of what Natasha went through, throughout the 5 years of our program, we have really gathered a lot of information from Google Analytics and the number of sessions and page views to user behavior, whether they're coming from Facebook or starting on our homepage. But we really wanted an opportunity to capture self-reported behavior, experience, and feedback from the users themselves, and to really understand who they are and if they're satisfied with the information they're finding on Baby's First Test. So in October 2015, we developed a user survey that went on the site to really help identify areas of babiesfirsttest.org where users would like to see improvement, as well as highlights, site features, or educational tools that users either find valuable or informative. So looking over the purpose and process for this, part of this survey launched in October 2015. It closed in February 29, 2016. And again, it was to evaluate the clearinghouse's impact, as well as to really inform the clearinghouse's understanding of the types of users visiting the site, the reason for users visiting the site, and to evaluate whether Baby's First Test was meeting the needs of its users. It was a convenient sampling method, and before we had actually conducted the survey, we really wanted to make sure that those that were taking the survey understood the terminology used. So prior to launching the survey, we conducted cognitive testing that was done in August 2015, and this was to understand the preferences for terminology related to newborn screening among our target audiences, and to test for clarity. Again, the purpose of this survey was really to understand the types of users, who they're coming, and to really inform our educational strategies and outreach. Before we really get into this survey, I did want to go through what we learned from our cognitive testing. This cognitive testing, we had a small number of respondents, about 27. This was limited to parents who just recently had a baby within the past year or those who are expecting in the next 6 months. And what we find is that, as those in the newborn screening community already know this, that there's general confusion about when newborn screening occurs, what it covers, when it's done, and why it is important. Respondents were not clear on the differences between newborn screening and other various tests that occur at the same time of birth. Inclusion of more clarifying terms when discussing newborn screening was suggested. As you can see in this chart, you can see some of the terms that a majority understand, including out of range, but there's also some terms that majority were unclear on, including screening and diagnosis. The thing about diagnosis is that most that completed this survey really thought that diagnosis meant that you were going to have a medical procedure being completed, or that those diagnoses meant the results of the test themselves. So you can see that, in particular, clarification of certain terms such as diagnosis may be needed when talking to families and parents about newborn screening. Of course, some limitations to this survey include the small number of respondents. We had about 27 complete cognitive testing, and this testing was conducted through telephone interviews, and the instrument was online. So these results really helped inform the creation of our user survey. After completing the cognitive testing, we launched our survey using some of that terminology that we found to be really useful among parents and healthcare professionals. So when looking at this, this is the completion of the initial pop-up. So when users went to Baby's First Test, a small pop-up window rose from the bottom of the screen asking for an initial question. And that initial question was really who they are. Are they a parent with a new baby on the way? Are they a health professional? Are they an advocate for newborn screening, or someone else? We were really able to see who was able to complete the pop-up and get that data. So as you can see, 42% were a parent with a new baby or on the way, and also to see how many completed of those about 3,200. So we had 713 completes of this survey who went through the entire survey. So if the pop-up was completed by the user, the full survey instrument was opened up for them in a different browser, and participants were asked to review the sites if they had not done so already, and they were given a $10 incentive for completing the survey. And then in terms of where this pop-up appeared, we did place this pop-up on our most popular pages. As Natasha mentioned earlier, we have our state and condition pages are one of our most popular, as well as the home page. And we did select a few conditions on the site, such as sickle cell and congenital hypothyroidism. We were really trying to be respectful for those that were going to Baby's First Test, that they may be in search of urgent information, and we want to respect that, so made sure that we only put it on certain condition pages. As you can see, a little more than 1/5 of those completing the pop-up survey went on to complete the full survey. And just to get an idea of how many people actually completed the survey, we, as Natasha mentioned, we have about 55,000 to 60,000 users per month, and from October to February, we had about 713 completes. So if I'm doing my math correctly, that's about 0.002% of people completing the survey. So just to get an idea of who's visiting Baby's First Test. So this is really from the final results. We found that it's about half. So half are family members of newborn, and about 47% are healthcare professionals, and then 7% consider themselves as advocates. Now, of those that identified as family members of newborns, we had about 19% as parents with a new baby on the way, and 18% of parents with a new baby. Now, to go into this a little bit more in depth, this was, as you can see in this chart, I'm not going to go through all the different categories of different health professionals or different family members of newborn, but we did get quite a range of people who identified with family members of newborn. We made sure that sometimes it is just a family member, not the parent that is looking for information, or a parent with an older child diagnosed with disease. We found that was 2 to 7% of people coming to the site. What was interesting, if you look at this red arrow, is that if a parent with a new baby, they actually, the higher percentage, about 50%, had in-range results, so it was normal or evidence of no evidence of a medical condition. I think this was not necessarily what we were expecting when we did this survey, is that we were expecting, parents that had a child with either out of range result, or they're still in that confirmatory stage, or yet have not received results. But we actually found that they had already received the results, and it was in normal range. Now, looking at the respondents' characteristics, we found that the sample is made up mainly of respondents identifying as the white race ethnicity. Very few of the advocates completing the survey identified themselves as something other than white. The other racial and ethnic minorities that were represented in about the same proportions, so Black or African American accounted for 8% of the sample, multiracial 6%, Hispanic 5%, and Asian 5%. As you can see, for age, most respondents fell between the ages of 25 and 44. And for those that identified as a healthcare professional advocates, were about 1/3 were the age of 45 to 64. When looking at education and income, nearly half of the family members reported having an undergraduate degree or higher. And in the healthcare professional sample, just over half the sample had a postgraduate degree. For income, respondents reported a diversity of income levels, but family type respondents had more respondents that fit into the lower income brackets. When looking at this, you can probably tell that this is not reflective of the U.S. population. That was something that was made very aware during this process of who's coming to the site and who's completing the survey as well. So looking into, we asked a question about the reasons for visiting Baby's First Test. And now if you really were to look at just the family members and their data, most of the family members wanting to learn more about screening of their newborns received and what conditions are screened for in their state. Kind of less than 15% really want to learn more about medical conditions or advocating or even looking for a specialist. We really, that first bracket of wanting to learn more about the screening and really looking for state-specific information. Now, if you were to look at healthcare professionals and advocates, a higher proportion of the advocate group reported wanting to learn about to advocate for newborn screening issues, learning more about state testing, and medical promoting their state's requirements to others were also common reasons for visiting the site. If you were to look at healthcare professionals, more so than others, they really wanted to get tools for communicating with parents. They were also interested in learning that it could be a resource for parents, and some open-ended responses that we received, looking for brochures, information to provide to parents when a certain state screens for a certain condition. That was a very common response. And then compared to the healthcare professional and the advocate group, a higher proportion of the family group really wanted to obtain more information about medical conditions. Now, in terms of one thing when you're looking at our analytics, most people come to the website, find what they're looking for, and sometimes it's a one-time only. They need more information about a condition, they find a support group, and then they go on to the next resource. We did find that a large majority of respondents reported that they do plan on visiting babiesfirsttest.org again, with the highest proportions reporting that they plan to return the next day or two or within the next week. Advocates and healthcare professionals were somewhat more likely to report that they plan to revisit the site in the next few months. And overall, about 25 of the respondents chose this answer. Now, we really want to also understand the usability and experience with Baby's First Test. And so we wanted to understand if people were finding what they were looking for. Most respondents, about 85%, reported that they were able to find information they were seeking and agreed that the information was easy to find. And most respondents, about 90%, said their questions were answered by visiting the sites. There were very few responses regarding info that they could not find easily, only about 70 responses of the entire 713. And mostly those kind of went into categories of finding educational materials. Some of the family members wanted more information about policies of a particular state. So if you go to our state page, you'll find that we have policies listed under each state, and so they would like even more information than those listed. And some of it was very detailed information in terms of they wanted more information about home births. And we'll get into how this surveys will be informing our education and outreach strategies shortly. In terms of the new information learned, 65% reported that they had learned something they didn't know before, with many of them, 41% reported learning about state testing policies. So that was a theme that we found throughout the survey, was needing information or finding information about state policies. Respondents also reported learning about the screening process rationale and gaining clarification on the elements of the screening process. And if you go through, those are just some more of the details of what was put into this open-ended section. So people actually wrote in updates on the RUS, which is the Recommended Uniform Screening Panel, timeline for screening and the importance of timeliness, possibility of a false positive on a test, and a slightly greater proportion of healthcare professionals, about 68%, reported that they learned something new compared to other types of users. So what's useful? We really wanted to understand what parts of the site were useful to our users. I'm not going to go through this list entirely, but this is just some of the mentions within the open-ended section that people thought was really useful. About 50% of those that responded did not have comments on kind of the less useful elements. Some of it, I would say the most common of the less useful was the graphics and the interactive media, but that was also listed as something many respondents said that was very, very useful. So something to take with a grain of salt. Only about 10% responded to the less useful piece of this, and about those 10% commented on the graphics. In terms of looking for suggestions for additions or changes, most respondents had replied that they would add nothing or nothing needed to be changed. Most have a positive comment about the site. The most frequently suggested additions were requests for more expansive information on newborn health topics, so topics outside of newborn screening. And so our program is looking into, how can Genetic Alliance and the Expecting Health program really reach that piece of what consumers and users are looking for. And then finally, a common theme within the what could be added or changed was looking for more aggregated information. Some of the suggestions included contact information for each state's screening program, a comprehensive list of conditions to investigate, filtering and browsing options for different conditions, and integrating screening requirements for states into interactive map of the United States. And of course, comparison charts for full recommended panel versus required panel of particular states. And for those of that sample, for about 713 respondents, only 334 really responded to this question. And as we went through a lot of these suggestions for additions and changes, really thinking about how can we improve babiesfirsttest.org. And so that's something that I'll get into in just 1 minute. That's kind of a brief overview of the survey. Of course, if there's questions at the end, we're really happy to take those. And if there's anything that you would like more information on, we have the full survey report handy. So looking at our user survey and kind of the feedback that we received over the last year, thinking about what's new on Baby's First Test and how can we improve the site even further. One piece of this was our interactive national map. We often receive requests for aggregated information, as you saw in the survey, on what conditions are being screened for in which states. So in September 2016, we officially launched our interactive national map that allows users to really easily see what recommended uniform screening panel or RUSP conditions are being screened for in what states. On the screen, this is just an example of what you'll see for ALD. We decided to start with RUSP conditions, although we may look to expand this in the future. This data is really being retrieved and pooled from information on our state and condition pages. So if you are part of a state newborn screening program and you started screening for a particular condition and it's not reflected on the map, it also means that it might not be reflective elsewhere on the site. So please make sure to send us your updated information and we will make sure to update the site immediately. Something to note with the interactive map, if you do click on a particular state, it will lead back to their state page. And if you look to a certain condition, you can also look at the condition page on our site as well. Another request that was, as you tell in the survey, was particularly among healthcare professionals, was asking for those educational resources. We have educational resources throughout our site on different pages, but the request was really to have one central location for users, whether that's an expecting parent, a new parent, a person of the general public, or health professional, being really able to find the information that they're looking for in an easy location. So we created a resource center. So if you go to our site at the very top, you'll be able to see right where my mouse is, this resources button. And in that resources button, you'll be able to locate the main page of our resource center. This resource center is really looking for newborn screening, education, and training resources. So we will be featuring fact sheets, videos, promising practices, educational tools from states and organizations across the United States, as well as Baby's First Test resources. You can simply filter by resource type. So right now there's fact sheet, video, webinar. Of course, if there's something that you are looking to add and it's not on this current list, as we receive resources, we will update the type. And you can also filter by who it's created for. Is it for expecting parents? Is it for the general public? Is it for policymakers? Or is it really dedicated toward health professionals? And so those are some, and you'll also be able to see what the resource key. So was it created by Baby's First Test? Was it created by a state program? You'll be able to search all of that. For those that are interested right now, we are reaching out to different states as well as organizations for adding their educational resources. If you are interested in adding your resource, you can email resources@babiesfirsttest.org for more information. There's a small survey to fill out about your resources, and then at the end of each month, we will be adding resources. And so just to give you an idea, so if you were to add your resource, each page you have an option for if you want printed resources. Baby's First Test allows current users to fill out this form, and we send them resources within a 1 to 2 week span. Organizations can also customize this form. So if they would like an email, if you would, for say, added a fact sheet to our site and you wanted to send this fact sheet and have it printed for those that wanted it, we can customize this for you. That is one option. The other option is that on each page, this is just one of the main landing pages. So this is our What to Expect from Your Baby's First Test infographic that we created in September. This was produced by Baby's First Test. Of course, if this was produced by a different organization or state, it would have the author here, the type, when it was published. You can have a picture. You can see the beginning of this picture of your resource. You can have a video, and you can also have a download now button if you want it accessible immediately. We will be able to provide statistics for you regarding how many people have downloaded from our site. So we can provide those quarterly or yearly. I do recommend you checking it out. Let us know if you have any questions, if you have any feedback, or things that should be added. You can email resources@babiesfirsttest.org. and that is the Download Now button. So lastly, one of the main features that we created this year was our Newborn Screening Public Square. The Newborn Screening Public Square was really designed to be an open space dedicated to ongoing conversations about newborn screening, really a commitment to new ideas, knowledge sharing, and bringing together a range of communities and experiences within newborn screening to help improve both education and awareness. And so one of the reasons why we decided to create the Public Square, which it officially launched in August, and we had our first Public Square in September for Newborn Screening Awareness Month, was really, we wanted to hear from different perspectives from those that are inside and outside of the newborn screening communities. So for those that are in the newborn screening community, many times during those meetings, we often hear from the same people, or the same people attend those meetings, but we really want to know, we wanted to have an open space for continued dialogue and to really include those communities that may not be involved in those meetings, and making sure that this is in and outside of traditional means for having those conversations. The public is the main audience for this, although we may have certain public squares that are more geared to those in the professional community. So if you currently go to the public square, it's on our main homepage, you'll be able to see there is a public square just with a webinar. So if you have questions about the public square, you can post. There's also a public square in the newborn screening community. And then we also have a public square about assessing the social and ethical implications for adding a new condition. So feel free to check those out. We are aiming in the next few months to have ones that are more dedicated toward the public, but they are open to everyone. So 8 things you should know about the public square. If you have ideas for a topic, you can always email info@babiesfirsttest.org. So if there's something comes out of a meeting, or something that if you, for example, work in a hospital and you're a nurse and you really want to talk about informed consent for parents and you think that that's an important topic to discuss, then please let us know. We're happy to think through what they would be each month. The type of content, for now, if you look at the different types of public squares we currently have, we had one that was more open-ended, and our current public square is really based off of a sheet, a chart that was formed from one of the newborn screening community meetings earlier this month. And so we're willing to put lots of different type of content for people to respond to. And also each public square will have some type of document or ending document. So at the end of this current public square, we can have a chart, a finalized chart based off the discussion that was had within the public square. We are completely different types of content, so please let us know if you have something in mind. In terms of frequency of public squares, we're currently aiming for 1 to 2 each quarter. That may change over time. And of course, the open period for public squares currently ranges from about 2 weeks to a month. When a public square closes, each public square will have their comments public and available to view, but at the end of the closing period, you'll no longer be able to comment. Each public square is moderated, so whether that's someone from the Babies First Test team or from a different organization, each public square has a moderator that will help kind of guide the discussion, ask additional questions. And then, of course, to comment, each user must use either a LinkedIn, Facebook, or Google account. And as I mentioned, each public square will have some type of ending document that will lead to our resource center. And so I'll give an example. This was our question for Newborn Screening Awareness Month of how can we really maximize efforts during Newborn Screening Awareness Month and increase awareness about newborn screening. We received lots of good replies. This was someone from the public who had commented in terms of what her plans for advocating for newborn screening and talking about her child with ALD. And then we had someone from a state department, or not state department, a state newborn screening program comment to Jenna. It was a great dialogue and kind of shows what's possible with the public square. Of course, this is a learning process for us. So as you go through the public square and you have questions, we're willing to hear from the public and from the newborn screening community about what you're interested in. And lastly, of course, opportunities to partner. You can submit a topic. You can help moderate a public square, or perhaps you would like to add your expertise to a certain content area. So if there's something about nurses and midwives and you want to talk about newborn screening education in that realm, feel free to lend your voice. And of course, you can always just join the discussion. So what's next? I know we covered a lot in terms of the survey, where we have been, where we're going. Throughout this past year, we created a newborn screening education flowchart, really mapping out all the different places newborn screening education may occur, both inside and outside the hospital, and also mapping out our current education outreach efforts, who we are reaching and where we want to go with our efforts. We have a lot of data from the survey, and we also, this year, the Clearinghouse will be targeting some of its education outreach efforts toward distinct audiences. We actually do have a poll here, and I would love for the community to engage it first, to talk about, in your experience, what population in our community do you see as having the greatest need for newborn screening education? And you can select one of the following. I'll give you a few minutes to take the poll.
We can see the numbers rolling in as you guys are typing in, so thank you so much. It's almost evenly split right now amongst the first four, but we'll leave this open for a little bit longer.
Great. So as you can see in the chart, 17% had rural to hard to reach populations, 27% limited or no internet or hard to access populations, 22% nurses and midwives, 27% expecting families and really focusing on that prenatal space, and then 7% low income families. So this is a really interesting mix, something that we're looking forward to in the next, as part of our summit, which I'll get to in a few minutes, but also part of the next year is really looking to see which communities really have the greatest need for newborn screening education, where we can make the most impact, and where does that really fit into this newborn screening chart that I was describing in terms of where people are finding their information, whether that's in and outside a hospital setting. As many of you are aware, within the public knowledge, I mean, most people in terms of parents and family members kind of receive their information from other family members. And so where we can put our education efforts to make the most impact. Thank you for taking that poll. I think that's really helpful in terms of guiding where the newborn screening community and those on the call really feel that newborn screening education needs to be improved or increasing awareness, particularly for newborn screening. So that leads us into the summit. So Baby's First Test will be holding a summit in April in Washington, D.C. In terms of agenda and registration, those will be available later this month. For the summit, it will be a series of workshops really aiming to understand the goals and support needs for education activities throughout newborn screening, and to identify and review best practices in newborn screening education. Our goal is to make this really interactive. We're hoping for, having participation from each of the states, including an educator as well as a member of the public, and really being able to understand how the emerging opportunities and potential impact as the newborn screening system continually evolves will have on current newborn screening education strategies, and really engaging key stakeholders from multiple sectors and disciplines to kind of inform our education strategies and practices. While it is open to the newborn screening community, we are aiming for states to be involved, although if you're interested, we'll have more information on our sites shortly. And it's just on our main page on our site. If you go to About Baby's First Test, you'll see information about the summit. Of course, if you need any additional information, you can also email me at Jackie@babiesfirsttest for more information. Now I want to open this up for questions. We have about 15 minutes to answer any questions. And I see a couple. Or maybe not. That was Natasha.
One question that did come in was if we would be accepting resources from pharmaceutical companies. And I think that's a really important question because you know, there are some really great materials out there that have been produced by different entities, whether those are companies, state programs, nonprofits. In terms of the from a pharmaceutical company, we are still in the process of developing our process around that and what that would mean, and working with our steering committee on that. But if you have something that you think would be a good fit, or an example of something that you would like to see in the resource center, please send that our way. Having some of those tangible examples will really help us have that conversation with our steering committee members, and particularly our co-chairs, in terms of what we should, could, can have in the resource center, and how we would then be able to distinguish that. As Jackie had mentioned, there is a short kind of form to fill out so that we can capture some information to go along that. So that would be great. And I see we have another question about if we will be providing travel support for the upcoming symposium. We are in the process of trying to work that out with our funder, HRSA, on that. So we are hoping to have some more concrete information about that in really the upcoming week or so, hopefully sooner. But we would need to raise additional funds to be able to do that, but that has been our intention from the beginning, to be able to support the travel for those who are connected to a state, because we know how critical that is to be able to get state people who work in the state programs to be able to attend meetings. So I hope to have an answer on that very shortly.
Great. Any other questions?
We're starting to see some come in. Just give us a moment to read through them. So we have one question coming in that's asking for a little bit more information about the testing methodology and the information that we gathered from the user survey, and that it seemed that some users wanted more information about testing methodology and what our approach is on that. So that is one thing that when we saw that, excuse me, in the user survey, it would be great to be able to have the opportunity to kind of delve deeper into that in terms of, was the issue that they didn't know when the heel stick would be taken, or is the issue more, you know, they wanted to know more about the metabolic screening and all of those other components. So we're hoping to be able to get more information on that. We also, as we do for all of the content on the site, as there are updates to the technology that may influence the test or have an effect there, we will update our information with that. Now, whether that is, you know, we do not have on our site anything about, you know, whole genome sequencing or anything like that, because that isn't part of, newborn screening programs, but in some of our other programs in other areas through Genetic Alliance, we are looking to see how to address all those questions that people have, because a lot of that does get conflated, particularly in the media, and so we're trying to see how we can kind of have people be able to have a place where they understand what's going on. But at this point, we're just kind of refreshing our content as we typically do.
Great, and we just received a question about, will this recording be available? It will be. Within the next 48 hours, it will be posted on the Baby's First Test YouTube channel. I will also be sending out a follow-up email for those that registered for this webinar with both the link to that webinar, or to the recording of the webinar, as well as an evaluation survey.
We've had another question come in asking about our outreach that we do via social media. We have been present on social media for a number of years at Baby's First Test, particularly on Facebook and on Twitter. We are on Pinterest, but we really focus our efforts on Facebook and Twitter. And the ways that we have been active there is we share information on our Facebook page. We really connect with other organizations, other departments of health who are also interested in getting newborn screening information and reaching out. Those partnerships have been really great. And sharing everything from stories to family stories, to sharing information about our new modules, but we use Facebook the same way that we kind of use the site, which is to share other people's information and to be able to talk about newborn screening as well as how newborn screening fits within the context of other issues happening around pregnancy, delivery, and early childhood. On Twitter, we do kind of similar in terms of different posts around a range of different topics, but we also partner with organizations and do Twitter chats. We typically do one in September, which is Newborn Screening Awareness Month, but we have also done them at other times of the year, focusing on a range of other topics. And we're always looking for ways to partner with people and to use these social media technologies and these platforms to have the conversation around newborn screening and all the different issues that are in newborn screening, and connecting with others. We've actually, when we first started around with Twitter, we were actually reaching a good number of nurses, and that was an unexpected but really great outcome, to be able to connect with people who are interested in these topics. So we're always looking to learn and seeing how we can do that, and to expand our social media reach and to expand our partnerships through social media. I see we have another question asking if we've considered authoring articles for sites such as What to Expect and Baby Centers about what we offer. That is something that we are really interested in. It's I think a main issue for us on that is kind of bandwidth. But one thing that we have done in the past is reach out to groups who have information about newborn screening, and we have offered them content. So, when Baby's First Test first launched, it took us a while to get on their radar, but we did actually help the team at whattoexpect.com to update their content. We've been in some conversations with Baby Center about what that looks like. Seeing as we're not a government entity, a lot of times that falls under what they will classify as advertisement, and we would have to pay for that. That's something that some people may not know, but all that wonderful free information that's out there is paid by someone, and oftentimes paid by the person who develops the content. And so that is something that is tricky for us, being federally funded and having to use our funds wisely and within a particular perspective. And on the one hand, that can be interpreted as outreach, putting out an article. On the other hand, some may consider that advertisement and get more scrutiny. But it's something that we're definitely looking at. If anyone has any suggestions or contacts or connections in that realm, we would love to hear about that, because as we know, we are very proud of our stats, but I think the last I heard it was that Baby Center gets 30 million views per month. So that's on a whole other level, which is great. And if we can use those channels that are already reaching people and get our content there, we are more than happy and eager to do that. But I think that's a really great question and something that we're always thinking about.
Great. And we received another question about how can someone volunteer to help, whether that's outreach or writing. I think that's a great, what a great question. I think that if you're interested, you can email either myself or Natasha. Right now, there's not a formal way to help volunteer, but we do have people from genetic counseling who, would like to help with the writing of some of our condition pages or fact checking, or even we do have a consumer and community work group that, is really being used to do that type of outreach. And so whether that's, talking to people in their community or doing some outreach and writing for us, whether that's in a blog or for other blogs, I think that would be wonderful. So just feel free to reach out to us.
We still have a couple of more minutes if people have any questions or comments they'd like to submit through the GoToWebinar control panel. Well, it doesn't necessarily seem like anything else is coming in right now, but as Jackie said, you can always email us. We really appreciate you joining us today. As you said, the link will be available in the next couple of days, and you can always go back and go through. We presented a lot of information, we know that, but we really are looking for feedback and comments and ideas from the community about the work that the Clearinghouse has done. Starting September 2017, which is closer than we all think, that we will be entering the final year of this project. And so we really are looking to see how can we evaluate and what is the feedback that we can get in terms of how Baby's First Test, both as a program and a website, is useful, and how people on this call and in the newborn screening community are integrating it into their work, and really thinking about that as we come upon our final year of this program. So with that, I'd say thank you, everyone, and we hope you have a really wonderful day.